Greetings, everyone. Welcome to another edition of the Enterprise Edge podcast. My name is Mark Vigoroso, founder and CEO of the Enterprise Edge. I'm thrilled to be joined today by John McDaniel. He is the CIO at Trinity Health, but also comes to us with multiple decades of experience leading technology and enterprise transformation, modernization, digitization across a number of different venues and theaters. We're going to get into all of that. Tremendous body of knowledge, experience, and expertise that we're going to benefit from today. Many of you who are familiar with this podcast, we hear a lot from the providers, the vendors, the technology companies that are building software, they're building applications, they're disrupting established models of enterprise workflow automation and things. Today, we have a different perspective from someone who has been in the end user seat, the one who the CIO role that oftentimes partners closely with CFO, CEO, and COO partners to figure out how to navigate what's happening in the world of enterprise AI at the pace that it's happening. And John is in the midst of doing just that at Trinity Health, based out of North Dakota. So with that, without further ado, let's give John a proper welcome. John, thanks for being here with us today.
Thanks, Mark. Happy to be here.
Awesome. John splits his time between North Dakota and Georgia. Bless his heart, as I'm from Georgia, or I'm in Georgia. So God bless him for logging those miles. But happy to have this discussion. And as we often do, we're gonna get to know John a little bit. He and I have chatted a little, but I want to share a little bit of his interesting background with you all. And as always, if you all have comments or questions, just drop them in the comment section below. So John and I have something in common. We both worked at a company called NCR Corporation, the inventor of the cash register, used to be based out of Dayton, Ohio. John started his career there in 1977, about 36 some odd years before I started working there here in Atlanta. And I'm just curious, John, you and I chatted a little bit about this, but is there anything that you remember from your time at NCR, a lesson, a best practice, a mentorship that has stuck with you throughout your career?
Yeah, I think a lot of it, because I really started in the role of kind of identifying new systems, new applications, and creating a lot of the documentation associated with that. What I think I learned, and it's really been used throughout my life and my career, is really understanding here's the way the process works, here's the interaction with the processes, and here's what the end result should be. So I really looked at it from here's the inputs, here's the outputs, what's the process to get to the desired output. And I've carried that forward with every system evaluation I've done, whether it's an AI tool, an EMR, ERP, whatever it might be. So I think it gave me a good foundation to learn to evaluate and really set me up to be a very successful consultant for a number of years.
Yeah, I can definitely see that. It's just sort of the lens, and how do you objectively evaluate systems through the right lens, right? And potentially see through, what might be marketing as opposed to reality from the vendor.
I think that's really important because, again, that's really, I mentioned that I've carried that throughout my career. And a lot of the organizations I've worked with have looked at and said, okay, here's the cost to do something. This is what the vendor's saying the ROI is. So if you don't go through that process and do what my CEO calls thin slicing, which means getting down to this is what causes it to happen. And how does this solution remedy that problem? I don't think you can come up with a true ROI, and that's the practice we've implemented here at Trinity. Is we thin slice everything from start to finish and look at the cost versus the return on investment.
It's great. Is thin slicing the speed of trust concept from Stephen Covey? If I'm not mistaken, maybe I'm making that up.
I can tell you, it's my CEO. Every time we talk to him, he said, "Have you thin sliced it?
Have you thin sliced it?
You've broken it down and understand this is really what the problem is, or this is how the problem is addressed by the solution."
It's funny. That's when I was at NCR, one of the things I took away was the practice of 5 whys, right? You ask why. It's maybe maybe sort of similar to thin slicing, which is you're asking the question why 5 times to get to the ultimate root cause of whatever it is that you're trying to evaluate or diagnose or improve upon, right? It's not just being satisfied with the first why. Um, it's interesting. Um, all right, let's fast forward a few decades. You're now the CIO at Trinity Health. You're wrestling with and navigating a number of transformational efforts in parallel, working with folks like Workday and Epic, making huge strides at Trinity. I'm curious. Let's just take Workday as an example. Workday's in the headlines quite a bit these days. Was there a moment, and maybe it's when you were evaluating them using that criteria and that lens that you learned back at NCR? Was there a moment when you realized that Workday was the right fit? What made that decision clear for Trinity?
I think we went through the process. We took a little bit of a different process than most organizations have taken. And that is, we
Hmm.
had the vendors come in, and I hate to use the term vendors because ultimately I like to get to partner. So we
Partner.
had
Yep.
the potential partners come in and actually look at how we operated today, as opposed to doing an RFP, and then come back in a few weeks and say, hey, we saw what you talked about. We understand what your issues are. Here's how our solution addresses those specific issues. So
Mm,
they were doing some of the thin slicing for us.
got it.
And at the end of the day, it was very clear what vendor came out on top, which happened to be Workday, and it had a 90 plus percent of the votes for moving forward with Workday.
Wow.
Yeah. And we also looked at, you alluded to a number of projects we have on underway. We knew at
Mm,
the same time we were selecting two major products for this organization, an EMR and an ERP solution.
got it.
And we looked at where they would cross paths, where the integrations were, and which vendors work best with which other vendors. So obviously, I wasn't going to take one vendor that wasn't called Workday and put it and integrate it into Epic versus taking one that does integrate very well into Epic. So that was part of the
Right.
decision criteria as well. I did that same thing for the EMR side of it.
Yeah. Yeah. It's not a decision in isolation. It's an integrated
Correct.
whole. Right.
It,
Exactly.
it was not an IT decision at all.
Got it.
In fact, by that time, we decided we didn't want to be IT anyway. So
Yeah.
we changed the name to Digital Transformation Group, which people view us now as an asset or a
Mm.
consulting organization within Trinity, really focused on digital transformation for the entire health system.
That's awesome. So let's talk about it. I mean, at Trinity, you're bringing a wealth of your prior experience that we'll talk about in a little bit more detail later on. But if I've done my homework correct, you've taken a position with regards to AI that there's sort of a difference between what you might call administrative AI and clinical AI. And clinical AI is obviously is fraught with a little bit more risk because there are clinical decisions being made. Um, but then I think you've embarked on a path with Epic to embed what you call ambient listening directly into Epic, right? Which is a way to capture spoken word, what's happening in a healthcare engagement, informing clinical judgments that end up making their way into the medical record of the patient, right? And so I guess I'm curious how you're navigating that. How do you think about risk? How do you think about situational awareness when it comes to applying AI, enterprise AI, where it applies, say, administratively as sort of a no-brainer, and maybe where it applies clinically, where it requires a little bit more discretion and maybe surgical thinking?
Great question. I think the way
Yep.
I would answer it is if it's AI or financial rev cycle based functionality, we look at it is what does this tool impact? What's the likelihood of it touching a patient from a clinical perspective? If it touches a patient from a clinical perspective, similar to what, but even ambience doesn't really do that. Just allows the physician to document the encounter with the patient. Ultimately, they come back and say, yes, this is what I said, or no, I didn't mean to say that. This is, but it gives you a lot of other advantages I'll talk about in a second that really aren't that risky. Where we are concerned with risk and what we're not allowing to happen is for a physician to go out and acquire a tool. First of all, it hasn't been vetted for security issues. We've had a couple recent examples of where somebody loaded an AI bot and it had a virus associated with it. So we were able to catch it early. So we've put that rule in place. But if it's clinically related, we're not going to allow it until, one, it's been vetted and approved by the FDA, because it is agentic. It's creating answers and suggestions based on previous experience with an EMR or whatever the experience is with the patient. However, what we are allowing is if they have a tool that says, hey, I want to go out and see what are all the symptoms associated with this, or specific diagnosis, or this other diagnosis that could be related, that could inform me as a care provider, we do allow that, but the physician is not using that to make a clinical decision. He's using that to inform him on the most likely best path to success for that treatment program. On the administrative side, if it addresses the rev cycle, patient access, patient awareness, those kinds of tools, we are allowing those. Again, they have to go through the security vetting process. But once they're vetted, we will bring them in and pilot them. And if they reach desired impact, we will allow that. We're doing a lot with rev cycle right now. We're doing a lot with coding. I mean, this organization significantly has undercoded in the past. So we're looking at tools that will significantly improve that. We estimate we lose about $36 million just on the ambulatory side for undercoding purposes. So that's where we're really focusing on the allowing of AI on those administrative processes where there's really work efforts that can be automated by a tool where there's very limited risk associated with it.
Got it. No, it's fascinating. I think the context is important to understand, as we mentioned earlier, not being in a vacuum and having the integrated whole understood and diagnosed as you're going through this. And I think, gosh, I mean, it seems like a huge undertaking that you've been involved with. You're running those two transformational work streams that probably have a whole bunch of sub work streams across EMR and ERP, right? You think about Epic and Workday being the primary vendors with overlapping timelines. And I think you're also decommissioning like more than 100 legacy applications.
Right.
And, pretty complex, from a business continuity perspective, also risky, right? So in the context of all that, if you think about Workday managing, simplistically stated, your workforce, and Epic is managing your sort of clinical side, how does the AI footprint or strategy or deployment approach, how does that look when you may have data living in two different clouds, or how do you think about the AI thread specifically when it's spanning across two very robust but separate systems that are obviously integrated, but they're still separate systems?
All the answers to that yet.
That's okay.
And if anybody does, I'd love to talk to them.
That's okay.
What we are doing is, to your point earlier, we are decommissioning a number of applications that have historical data in there that's relevant, both from a Workday standpoint as well as an Epic standpoint. We are basically migrating 2 years worth of all that data into Workday, so that is aggregated in a single cloud instance. And we're doing the same thing with Epic on their side, except it's for a longer period of time based on whatever the rules are, based on the certain document types. So we know we're aggregating the right data. The challenge we have had is not finding the data, but making sure the data is accurate. Data cleansing has been a real challenge for us because of the disparity of applications that we had. I can't say we had a single source of truth. We didn't. So the idea with what we're accomplishing now is aggregating that into either the Epic side, the Workday side, and we do have a third party. We're using LK for the archiving, as well as the migrations of both of all data into either Workday or Epic. So we've aggregated the data that's relevant. Now, with that in place, I can start to use those AI tools with
Yep.
the knowledge that, hey, this is the most accurate information to date that we have. So if I want to run it won't be agentic on the administrative side, but if I want to run a bot, then I've got the data to run against that bot. So that's the game plan. That's where we are right now. We will be live July 1st with
Wow.
Workday. So we're in
Oh,
our
that's
last
exciting.
75 days.
Oh, I was not aware of that. That's fantastic. We'll
Yeah.
have to have you back on for the after version.
Hopefully we can celebrate.
And
It has, back to your point earlier, and I know it wasn't a question, but it has been a challenge managing the implementation of two significantly sized projects. And I'm adding a third project to that now because we are on an old PAC solution, so we'll be moving to Sectra. In the gap between Epic and Workday go lives.
Hmm, no
So that
doubt.
it's been a stress. But the organization, I've never seen an organization, and I've worked in 1,000-bed hospitals and 150-bed hospitals that has come together like this organization has. 100%
Yeah,
commitment.
that's important. And we're going to get to that. That's a
Okay.
foreshadow of one of our closing questions. But you know, we were talking before we got started here. There are some patterns here that I think you saw early on years ago. One of the stops you made at NetApp over a decade ago, you were talking about the urgency around healthcare organizations decoupling enterprise data from kind of siloed or standalone applications in order to get at real insight, clinically speaking. And here we are a dozen years later, and now you're at Trinity, and you're you're in the midst of doing multiple rounds of supply chain data cleanup, and you're preparing for major systems migration. And I guess you could say, why, as a whole, as a market, why haven't we progressed further in a dozen years with regards to how we think about enterprise data management? But is it true, your perspective, that data management in healthcare has it gotten harder over the years? Has it gotten easier? I mean, multiple billions have been spent on interoperability and various data platforms. What is the state of data management in healthcare, and what are the implications for deploying AI productively at scale?
I think it's still a challenge 12 years
Yep.
after I made those remarks.
Yep.
I do think the foundation to enable more data standardization and optimization exists today. You've got some repositories like a Snowflake, a Databricks, and others now that will allow you to aggregate that data in from all those disparate systems to be able to inform an AI tool. But the cost of doing that is expensive. And I think that the biggest challenge, and I'm speaking specifically about healthcare, is the cost associated with accomplishing that task. I think people really don't understand how critical it is to get that part of it right. And if you don't spend the dollars to get that part of it right, I will say you will have a suboptimal implementation or solution implemented for long-term critical decision making.
Yeah, that's very helpful. No question. No question. So let's talk about kind of bouncing back to Workday a little bit. I mentioned Workday being in the headlines, right? There's so much going on right now with regards to leadership across enterprise technology providers. I mean, it's hard to pass a week without some major announcement all the way up to the CEO level. Companies like Oracle, Adobe, Workday, where CEOs are stepping down and new CEOs are stepping in. Or Workday's no different. Workday now has one of their original founders now, Anil, back in the CEO seat. And I'm curious, here you are, 75 days ish out from deployment. If Anil were sitting here with us, is there anything you would say to him or ask of him at this point?
I think I think I understand the reasons for some of the changes that were made.
Yep.
I would encourage him to keep investing in some of the AI tools that would really enable better decision making around human resources,
Hmm.
around supply chain management, around just being able to do some predictive analytics around revenue generation and budgeting. I think they've got the foundation. They have a very adequate set of systems, and they seem to work well from our testing so far.
Yeah.
But I would say to me the difference maker, and I think it's any vendor, is
Yeah.
really focus on how these new advanced tools will enhance your implementations. I often say in a number of my speeches, and I've had published a couple times, I think the next 5 years in healthcare will dwarf the first 200 years in terms of advanced capabilities.
Wow.
And a lot of it is based on or predicated on being able to have those foundational systems like an Epic or a Workday, and the ability to utilize the new AI technologies to do a much better job of delivering the quality of healthcare needed at the cost that it should be delivered at.
Yeah. Yeah. No, that's a compelling statement. And in fact, kind of answered one of the questions I had in that regard, but maybe I'll bring it up anyway. I think it's important for people to understand kind of the road that you've traveled, John, is it's certainly a long road. It's also you've had some pretty impressive stops along the way through healthcare, a lot of different roles since NCR, right? You've made stops at McKesson and Dell and Siemens and Emory and Deloitte and NetApp, and you're probably as well positioned as anybody to make a statement like that you just made in terms of the next few years, and what's going to happen. With regards to enterprise AI, one of the things I'm curious about in healthcare, is there's a lot of speculation these days, and there's a lot of panic, to be honest, in the public markets about the status of typical SaaS providers like Workday and Oracle and SAP and all these guys. Not no, I mean, I don't know how many trillions of dollars of market value have been lost in the last 3 months, but it's 1 or 2 trillion, if I'm not mistaken. And one of the thoughts is that, is there a day coming quickly or not so quickly where AI tools supersede the legacy SaaS model where you have this sort of like prompt driven conversational front end, cutting across historical functional silos? You have workflows that are end to end, and you have work that's being executed semi-autonomously, sometimes being prompted by a human, sometimes being approved by a human, validated, whatever, overridden perhaps. But the whole paradigm of enterprise software is being challenged, or at least is being questioned, and it's showing up in investor panic, right? In some of these legacy, you call them legacy, right? The big enterprise software guys, Workday among them, to be honest with you. And so I'm curious, over that time span that you just described, where you see this sort of transformational season in healthcare, the likes of which we've never seen, over hundreds of years. How do you interpret that? You might call it a trend, or you might call it just a dialogue that's happening in the market right now, where the fundamentals of enterprise software are being questioned, in terms of how AI, not necessarily augmenting or strengthening enterprise software, but in many ways replacing it. Is that, how do you think about that?
I guess companies today that have initiatives in that space, Oracle being one of them.
Yep.
I mean, some of the work that Oracle is doing with AI will reduce the need for a number of traditional legacy type applications,
Yep.
much more dialogue oriented. Again, as long as the data is out there to provide or inform the AI tool, yeah, I see if I was a legacy vendor, and I have been, um, I would be I would be concerned. So I understand the fear from investors.
Yep.
I am not investing in legacy vendors
Yeah.
today anyway, not because of
Hmm.
that, because I feel I can't. But
Yeah.
if I could, I would have that concern. My dollars would be going toward well-researched organizations that are making investments in the area we just talked about. I do see that as, I mean, ultimately, that's where we would like to get to.
Yeah. Yeah.
I don't know that we can do that in true patient care, in rendering of
Yeah.
patient care, but I can certainly, I mean, I reviewed a video yesterday of a company that now has a phlebotomy machine that you can sit down and does everything for you, including poke you, take the results, and it's being reviewed by the FDA. Those are the kind of workflow improvements I see that would eliminate not only a legacy system need, but an individual need.
Hmm. Yeah, it's a hard time to make predictions, I think. I mean, I think your prediction is spot on in terms of the degree and the magnitude of change we're going to see. I don't think healthcare is any different from any other industry that we look at. It's somewhat unprecedented. I've lived through a few disruptive seasons. You've lived through more, but there are always statements that are made about the magnitude and the scale of disruption and innovation, and none of them compare to what's happening, I think, right now with AI in the enterprise space.
I think it's
Um,
a conversation because I think a lot of the challenge, a lot of money we have spent on legacy applications. I think the new generation of functionality will be much less costly.
ah, yeah, yeah,
I'm not modeled out, but that's my gut instinct when I think about it.
yeah.
Because I won't have to all the developers coding the legacy applications, maintaining them.
That's right.
No, I
You
mean,
got it.
I think it's going to be a lot less. It's going to be a lot less costly. The challenge healthcare will have specifically is, you know, if we don't deliver services, we don't get paid, and a lot of times payers are very slow to pay, and our
Yeah,
margins are dwindling very quickly. So, it's a
yeah.
challenge for our industry to make the investments, I think, um, that are needed to get us where we need to go. It's a slow
That's a
process.
good.
We'll be slower to adopt than other industries.
It's a great point. Yeah, it's a great point. I mean, so you think about, I've got teenagers, and we're looking at fields of study that are still going to be relevant when they're in college, and software engineering is not one of them. um, to your point about how coding is going to happen and is happening, right? Um, so interesting. Um, cool. Now, let me ask. You kind of have already answered this, John, a couple different ways, but I think I'm going to ask it anyway because I think it's worth netting it out for people who are listening, and that is when it in all of your years, when it comes to a successful, just call it enterprise technology deployment to genericize it, what percentage of that success depends on the technology itself as opposed to other factors like process design, data readiness, change management, etc.?
It's a really good question,
Yeah.
and based on, and I've done hundreds of implementations.
Yeah.
Based on my experience, the technology is not the game changer.
Yeah.
I mean, I can buy a less sophisticated tool and functionally make it work as well as I can a sophisticated tool by focusing on the things you just stated, by focusing on the work process. Does this automate and change the work process to be more consistent with the goals and objectives of the organization, whether it's patient care, billing, or whatever it might be? I think just being able to aggregate the data. if I've got the most sophisticated system in the world, I've got data spread all over where every place is not normalized or standardized. What have I accomplished? I spent a whole lot of money, but I probably have not had a major impact on the organization from a cost perspective. So I think, I think you really want to make wise decisions when it comes to technology, but don't lose focus on those other. I think they're much more important over time.
Well, absolutely. I mean, they're already saying now, right, that the winning, to your point, partners. I don't like the word vendor either, but the winning technology partners, they're not going to win in like a feature versus feature bake-off. They're going to win on all the other factors that you just sort of alluded to when it comes to vertical knowledge, process knowledge, partnership, call it services expertise, delivery track record, flexibility, optionality, especially these days when things are changing so fast. Some of these vendors are having to live with way more flexible contracts and fewer lock-ins and things like that. And so I think it's playing out. It's sort of bearing out as you've described. It's like the technology is important. It's sort of like table stakes, right? You have to have the table stakes capabilities, and those are constantly moving in this day and age with enterprise AI. But it's so much more than that when you're at the enterprise level and the scale that Trinity is at.
I
Um,
think lots of, as we went through the evaluation process, we looked at the EMR vendors, is
mhm.
they each came in, like I said earlier, came and looked at our process and came back with solutions. Then they said, we also can do this, this, and this. And I thought, that's cool, but so what? It
Yeah,
doesn't matter. It doesn't have an impact on you. Yeah, it's really sophisticated looking stuff, and I'm a technologist. I like that stuff, but it's really not going to impact my day in and day out operations. So, you know, just make sure your technology platform does accomplish the goals of the organization.
absolutely. So you probably already given me six different answers to this question, but if you were to have maybe some CIO peers, healthcare or otherwise, a lot of what we're talking about here today, I think, is portable to other industries. What advice would you have based on your learning so far, specifically with regards to the season that we're in right now, with this sort of landscape of enterprise AI that is shifting so rapidly and in some cases unpredictably? What advice would you have? Maybe a couple of nuggets that you would have for peers of yours, or maybe young, up and coming, aspiring CIOs.
They don't go it alone.
Yeah.
Have a group working with you. One of the things we've done quite successfully here is establish some governance. So
Hmm.
I've got a governance council for AI. I have an executive steering committee that in essence is a governance council for EMR and ERP. So I don't make the decisions. I work with a group of people to make those decisions. So again, it's not my decision. If I made the decision, it's likely to fail. If
Hmm.
the aggregate of my colleagues and peers make the decision, they're going to make it be successful. So
Hmm.
really engage your stakeholders closely and listen to them. I think that's the thing I've learned throughout my entire career. And I think secondly, don't be overly enamored with the technology. Get down to what you're really trying to do and what's really going to work for your organization.
It's very wise. Yep. Yep. Absolutely. Okay, so couple more, and we're gonna have to let you go for this time anyway, John. But maybe a few fun ones here. What we've already talked about North Dakota, right? A little bit off camera, but it's a state that not many have been to. I would argue. In fact, I've been to 45 states in this country, as I told you. North Dakota is one of the five I have not been to. Um, you've logged who knows how many miles going between Georgia and North Dakota. What is one underappreciated characteristic of North Dakota?
People,
Yeah.
I mean, one, it is prairie, but
Yeah.
there's some amazing landmarks here. In the
Mm.
northwestern side of the state, I mean, the fishing here is unbelievable. It's the best walleye fishing in the world, by the way.
Oh
I have
wow.
learned. I'm an avid fisherman. And that's how I
Yeah.
deal with my physicians is I'll help you, you help me, but take me fishing. I think, but the people are genuine. I mean, they care immensely about this state and their community.
Mm.
The other thing, which is kind of, and I've had a really difficult time understanding this, but they love to drive. Because I
Mm.
keep talking about, let's do things with technology around telehealth. And the CEO says, why? People want to drive for 3 hours. I don't get it why, but they
Yeah.
do. So I've had to figure out when I created some strategies, okay, is there drive time involved?
Yeah.
But I mean, if it really comes down to, I just love working with the people here. They're genuine, they're real. They you know, they work with you.
That's great.
And I'm an outsider, so I could say that.
Yeah. Well, it's on my bucket list. I will make it there one day.
We'll do some
Um,
fishing.
absolutely. I'll bring my son. It'll be awesome. All right. I should have asked you this before, but could you just give us a sense of the size and scale of Trinity Health? I'm not sure if anybody knows that. Maybe just give us a,
Trinity is probably gross revenue around 900 million, probably 500 million net.
yep.
Well, number of beds have shrunk because we've realigned some. We've got 18, 19 remote sites. We move as far as Northwest Dakota around Williston, so that we're about 20 miles from Montana. We do treat patients from Montana in that location. We're as far east as maybe close to Devil's Lake, which is on the eastern part of the state, and we're
Mm.
about 15 to 20 miles from Canada. Minot itself is about 50 miles from Canada.
Oh, okay.
So the main hospital is about 175 beds.
Mm.
Critical access facility, which is the facility that's closest to Canada. And again, a number of remote sites.
And what number of full-time employees?
Right around 2,700.
2,700. Gotcha. That's good. It just gives the people a sense of
Mhm.
scale, which is significant, right? It's a pretty significant scale. Well, good. Well, John, this has been tremendous. I think, everybody is going to benefit from your perspectives here. I'm not surprised wouldn't be surprised if we hear some questions from industries outside of healthcare. Because like I said, I think a lot of what you've shared is portable to a lot of other industries that are navigating this season of enterprise technology. So I appreciate you spending the time, John. I know you're a busy guy. I'll do my best to grab you a few months after Workday goes live to get your perspectives, and maybe we'll toast to the success of that. I want to thank everybody for joining us for yet another episode of the Enterprise Edge. We will catch you next time. And like I said, any comments, questions, please drop them into the comments, and John or I will get back to you. Looking forward to the follow-up. Thanks, everybody. We'll catch you on the next episode of the Enterprise Edge. Take care, everybody.